Hello viewers. Welcome to another awesome edition of Living a Healthy Life, where we talk about how to live a healthy lifestyle. This video sheds more light on causes and treatment of malaria. Malaria is an infection of the blood that causes chills and high fever. Malaria is spread by mosquitoes. The mosquito sucks up the malaria parasites in the blood of an infected person and injects them into the next person it bites. Signs of malaria. The typical attack has 3 stages. 1. It begins with chills, and often headache. The person shivers or shakes for 15 minutes to an hour. 2. Chills are followed by fever, often 40 degrees or more. The person is weak, flushed, red skin, and at times delirious, not in his right mind. The fever lasts several hours or days. 3. Finally, the person begins to sweat, and his temperature goes down. After an attack, the person feels weak, but may feel more or less okay. Usually malaria causes fevers every 2 or 3 days depending on the kind of malaria. But in the beginning it may cause fever daily. Also, the fever pattern may not be regular or typical. For this reason, anyone who suffers from unexplained fevers should have his blood tested for malaria. Chronic malaria often causes a large spleen and anemia. In young children, anemia and paleness can begin within a day or 2. In children with malaria affecting the brain, cerebral malaria, fits may be followed by periods of unconsciousness. Also, the palms may show a blue-gray color, and breathing may be rapid and deep. Note: children who have not been breastfed are more likely to get malaria. Analysis and treatment. If you suspect malaria or have repeated fevers, if possible, go to a health center for a blood test. In areas where an especially dangerous type of malaria called falciparum occurs, seek treatment immediately. In areas where malaria is common, treat any unexplained high fever as malaria. Take the malaria medicine known to work best in your area. If you get better with the medicine, but after several days the fevers start again, you may need another medicine. Get advice from the nearest health center. If a person who possibly has malaria begins to have fits or other signs of meningitis, he may have cerebral malaria. If possible, inject malaria medicine at once. How to avoid malaria and dengue. Malaria occurs more often during hot, rainy seasons. If everyone cooperates, it can be controlled. All these control measures should be practiced at once. 1. Avoid mosquitoes. Sleep where there are no mosquitoes or underneath a sheet. Cover the baby's cradle with a mosquito netting or a thin cloth. Netting treated with insecticide works best. 2. Cooperate with the malaria control workers when they come to your village. Tell them if anyone in the family has had fevers and let them take blood for testing. 3. If you suspect malaria, get treatment quickly. After you have been treated, mosquitoes that bite you will not pass malaria on to others. 4. Destroy mosquitoes and their young. Mosquitoes breed in water that is not flowing. Clear ponds, pits, old cans, or broken pots that collect water. Drain or put a little oil on pools or marshes where mosquitoes breed. Fill the tops of bamboo posts with sand. 5. Malaria can also be prevented, or its effects greatly reduced, by taking anti-malaria medicines on a regular schedule. Thank you for watching this video. Please hit the subscribe button to subscribe to our channel so that you can get notifications for our subsequent videos. Health is wealth. They keep living a healthy lifestyle and stay alive.